Plaque, the substance that builds up inside blood vessels, raises your risk of heart attack. Major amounts of plaque cause big problems, but researchers wanted to know if smaller amounts were also a problem. They reviewed the records of 37,000 veterans with non-obstructive coronary disease, where there are smaller amounts of plaque. Those patients had 2 to 5 times higher risk of heart attack and death than healthier patients.
A fairly large number of people who receive a coronary angiogram come away with a diagnosis of non-obstructive coronary disease. And even though that disease may not be causing their chest pain, it does still result in a risk of heart attack and death down the road.
Americans suffer 1.5 million heart attacks and strokes every year, reminding us that cardiovascular disease is the leading cause of death in the U.S. Because of the risk, it's important to know the signs. Heart attacks can start slowly, so people may have no idea what's going on until it's too late. In today's Heart of the Matter, we have details on the warning signs of a heart attack.
Heart attacks can be sudden and intense. They can also occur more subtly, but the same things cause both types of attack, and both, if left untreated, can be deadly.
Heart attack happens whenever one of the heart arteries gets a blockage in it, and usually whenever we have a heart attack, this blockage happens sort of acutely.
So while a warning sign of heart attack may be crushing chest pain, there can also be other signs that people should be aware of so they have time to get help if they need it.
The classic symptoms that patients describe is chest discomfort, and many times they describe an elephant sitting on the chest, which is like chest pressure, what we call oppressive chest pain. However, there are different types of symptoms that can happen: chest burning, tightness, aching in the chest, sometimes just uncomfortable feeling in the chest.
The American Heart Association lists chest discomfort as one of the main warning signs of a heart attack. Having heart disease or having had an earlier heart attack also increases the chance of an attack. Shortness of breath is also a warning sign, as are nausea, lightheadedness, or breaking out into a cold sweat. And there can be discomfort in other parts of the upper body, including one or both arms, the neck, jaw, or stomach. Annette Franklin is in Baptist Memorial Hospital DeSoto, still recovering after feeling one of those warning signs.
I was at work on Saturday, and I started feeling tingling sensations around my mouth. So I didn't think nothing of it, so I went on doing my work, and I got a real bad headache, throbbing headache.
After checking in with a nurse at her job, she headed to the emergency room. She drove herself, but both she and Dr. Zogby say it's a better idea to make that trip in an ambulance.
It's important to call 911 for various reasons. Number one, you get quick access to the hospital. Number two is nowadays most of the ambulances, they have capacity to do the electrocardiogram in the ambulance, and they can determine as they're transporting the patient that they're having the real heart attack. And that actually puts alert to the hospital where they're coming, and that will activate the heart team to be on board to have them available as soon as the patient comes to the hospital.
Once a patient has been assessed, doctors will know whether to send them to the cath lab for intervention to break up a blockage, or whether other medical treatment can deal with the problem. Either way, it's important that people act quickly if they think they might be suffering a heart attack. Cardiologists use the phrase, time is muscle, which means the longer an attack goes untreated, the more heart muscle can be damaged beyond repair.
I would advise everybody, if you're having any tingling sensation, throbbing headache, pain in your shoulder, don't ignore it, because those are symptoms.
And symptoms without treatment can be deadly. I'm Doug Johnson for Smart Medicine.